Hi all, I'm Bincy here. So today we are going to discuss about chronic renal failure in medical surgical nursing genitourinary system. Okay, so chronic renal failure. Chronic means it's gone from our hand, which cannot. It's not like acute. Acute we can treat it, but chronic we cannot treat it. Okay, once it is damaged, that's it. Chronic renal failure will be rapid means like this, fast. Okay, acute was a slow progression, right? Chronic, there will be a rapid progression of the kidney getting damaged, as well as it will be irreversible. When I say irreversible means once it is damaged, it will never come back to the normal. Okay, resulting uremia and azotemia. Uremia we had discussed, which is an emergency situation. Okay, I hope you all remember. If not, go watch the video and then continue watching this, because you should understand what is uremia. Okay, then what are the etiology that can cause CKD? CKD is chronic kidney disease. Okay, so etiology, like any family history of kidney disease, then repeated episode of acute renal failure, chronic glomerulonephritis, chronic pyelonephritis, then TB of GU, trauma, okay, and then infection. This all are the etiology of CKD. Okay, moving on to the pathophysiology. Due to etiological factor, as we keep it as acute renal failure as a etiological factor, loss of nephrons, a large number of nephrons are getting damaged. As we know, once it is irreversible, once it is getting damaged, it will not come back to the normal, right? So large number of nephrons are getting damaged. Because of that, the undamaged nephrons are working for them, okay, taking their work and working for them. Because of that, the workload increases. Because of that, the kidney is getting workloaded. Kidneys excretory process is not happening. Because of that, signs and symptoms occurs. This was the pathophysiology. I think so, compared to acute renal failure, this is very simple, right? Due to etiological factor, okay, large number of nephrons are getting damaged. When the large number of nephrons are getting damaged, the undamaged nephrons are trying to get this work done by them itself. Okay, because of that, they are also not able to do their work, as well as the damaged ones work also. So workload gets increased, and even the kidneys workload get increased. Because of that, signs and symptoms occurs. And in acute, we had discussed about stages, right? Same here also, there are stages. That is three stages. That is, first one is initial stage. Okay, initial stage, there 50% of nephrons will die, okay, or get damaged. So when I say 50% of nephrons get damaged, there is no signs and symptoms in the initial state. Okay, and the second one is renal insufficiency. In renal insufficiency, 65 to 75 percentage of nephrons get damaged, and in that there will be all signs and symptoms, okay, like pericarditis, myocardial infarction, dehydration, hematuria, pyuria, flank pain, edema, all signs and symptoms, okay, including neurological disorders also will be present there. Okay, then the last stage is ESRD, end stage of renal disease. Okay, in this stage, almost 90% of nephrons will get damaged. Okay, the only treatment here we can do is dialysis or kidney transplantation. Or if it is left untreated, within week the patient can die. So you must understand how serious it is. Okay, so that was all about the stages. Moving on to the clinical manifestation. See, one organ, if it is getting damaged, all the organs are connected. Okay, so every organs will have that impact and the signs and symptoms. Okay, from neuro to like genitourinary, all the systems get damaged. In neuro, there will be cognitive impairment, there will be irritability, there will be having headache. Okay, then in cardiac, pericarditis, myocardial infarction. In pulmonary, there will be having pneumonia, uremic pneumonia will be there, then pulmonary abscess. Okay, in GU or genitourinary systems, already pyuria, dysuria, everything will be there. In gastrointestinal system, nausea, bleeding, okay, all that symptoms will be present. Especially GI bleeding will be there. Okay, because of GI bleeding, anemia can occur. Okay, loss of appetite, loss of weight will be there for the patient. Okay, then decreased libido will be there. What is libido? Libido is sexual disorder. Okay, so decreased libido means loss of sexual desire. Okay, then amenorrhea, reproductive system, amenorrhea is getting there. Amenorrhea means absence of menstrual cycle. Okay, then this was oliguria. Okay, this all are the symptoms which will be there. Okay, moving on to the diagnostic evaluation, history collection, physical examination, blood test especially will be monitoring BUN, blood urea nitrogen, as well as CBC to monitor anemia. Okay, then renal biopsy, CT, MRI will be done. Okay, this was all about the diagnostic evaluation. Moving on to the management. Before moving on to the management, what is our goal? See, our disease is rapid progression, right? So we cannot stop it. We cannot reduce the disease and all. So what is our goal is like we have to reduce the progression. It is fastly developing, right? So we have to reduce the progression by treating the cause. Okay, once it is hypertension, we can give hypertensive medication. If it is diuretic, we have to give, oh, sorry, if there is a swelling or something, we have to give diuresis. Okay, then symptomatic treatment like vomiting, diarrhea is there for the patient, so antiemetics can be given. IV fluids can be given. More IV fluids also we can't give because the person is will be having edema. Okay, why? Because kidney is not doing the proper work and all the fluids get accumulated here and there in the body. Fine, then all symptomatic treatment can be given. Dialysis can be given for the patient. Actually, dialysis will be given for the patient. So dialysis are of two types: peritoneal dialysis and hemodialysis. Okay, this topic we will be discussing detailedly in coming on videos. Okay, then kidney transplantation will be done for the patient. So this was all about chronic renal failure. I hope you all understood. If there is any doubt, please get back to me. This is an important, I'm stressing and saying it's a very important topic. Please watch the video without skipping, and if there is any doubt, please get back to me. Thank you. Have a nice day.